Hi, I'm Louisa Salisbury, first author of the paper Sensitivity and Specificity of two autism screeners among referred children between 16 and 48 months. I'm a general pediatrician at Mammoth Hospital Pediatrics in California, and I participated in this study as well as completed my pediatric residency training at the Floating Hospital for Children at Tufts Medical Center. Much of the focus of recent research in autism screening and diagnosis has been on early identification due to improved outcomes with early intervention. The recommended screening ages, according to the AAP and CDC, are 18 and 24 months. Widely used screening tools have been validated for ages 16 to 30 months. However, only a minority of children with autism are actually identified by 30 or 36 months. Also, early screening may not detect all children with ASD due to practical barriers with implementation of screening tools, as well as differences in clinical features of autism spectrum disorders. Longitudinal studies that have looked at children at high risk for ASD demonstrate that some children who don't meet diagnostic criteria at 18 months of age may go on to receive an ASD diagnosis when they are 3 years old. Children with milder symptoms of autism may still have impairments, but are typically identified later than children with more severe symptoms. Based on recent evidence regarding the wide distribution of ages at which children with autism are first identified, some have called for screening to be carried out until older ages. Unfortunately, there's a significant evidence gap with respect to the accuracy of these tools for children after 30 months of age. So we aim to assess the sensitivity and specificity of two readily available autism screening tools, the Parents' Observations of Social Interactions, or POSI, and the Modified Checklist for Autism in Toddlers, or MCHAT, among children referred to a developmental clinic between the ages of 16 and 48 months. The MCHAT is a parent-reported checklist of a child's behavior that includes 23 yes or no questions with 6 critical questions. At the time of our study, the revised MCHAT was not yet in wide use. The POSI is a parent-reported screening tool developed by a multi-institutional expert panel with the aim of creating a short screening test for autism that would be both accurate and practical for use by primary care pediatricians. It includes 7 questions, each with 5 possible responses, and it is one component of a comprehensive developmental screening instrument, the Survey of Well-Being of Young Children, which is available at www.theswic.org. At the time of this study, neither checklist had been systematically evaluated beyond the age of 30 months, and we hypothesized that both would demonstrate adequate sensitivity among children at least up to 48 months. The study is a retrospective chart review of children 16 to 48 months who were referred to the Developmental Behavioral Pediatric Clinic at Tufts Medical Center over a 3-year span for evaluations to clarify diagnoses of developmental delays, autism spectrum disorder, or other neurobehavioral disorders. Before their evaluation, parents were routinely asked to complete an intake packet, which included several checklists, including the POSI and the MCHAT. The children then received a comprehensive evaluation, including a thorough history, physical exam, direct observation of play, parental interactions, and direct testing. Based on these results, a multidisciplinary team, including board-certified developmental behavioral pediatricians, assigned a diagnoses. Since this study was based on a retrospective chart review, no follow-up interview was done in the case of a positive MCHAT. But it's important to recognize that the follow-up interview is intended to reduce false positives, so it would reduce the specificity of the test. It would have no effect on the sensitivity. Data were obtained for 524 children between the ages of 16 and 48 months at the time of diagnostic evaluation. 39 were excluded based on incomplete data in the chart. In our study sample, 61.2% of 297 children were given a diagnosis of autism spectrum disorder. In children 16 to 30 months, the POSI displayed somewhat higher sensitivity than the MCHAT. Among children 31 to 48 months, the POSI displayed a sensitivity of 75%, which was lower than in the younger age group, but still reliably above 70%. In this older age group, the MCHAT had a sensitivity of 69.4%, and as expected, both screeners displayed comparatively low specificity. Our findings support the hypothesis that both the POSI and the MCHAT have acceptable sensitivity up to 48 months of age, specifically in a developmental referral setting, warranting further research in primary care pediatric populations. The main limitation of our study is that the sample consisted of children who had been referred to a subspecialty clinic. Given the majority of our study population had some form of developmental delay, with symptoms overlapping with those of ASD, the children with potential autism were compared to a background population of children with delays rather than typically developing children. This means sensitivities of both tools in our population may be inflated and should be interpreted conservatively as an upper bound. Specificities in our study for both screening tools in both age groups were relatively low for similar reasons. However, both screening tools should have been influenced equally, so comparisons between them should be unaffected. Our findings have important implications when considered in the context of a growing body of data identifying children with autism who are not detected by screening at 18 and 24 months of age. The results demonstrate that two readily available screening tools, the POSI and the MCHAT, can be useful in evaluating these children beyond the recommended screening age of 30 months. Ongoing research evaluating these screening tools in a primary care context will provide data for a more generalizable sample to guide their use for routine screening of autism at least up to the 4-year health supervision visit. Thank you for your interest, and I hope you enjoy our study.